I didn't. He just got his senior pictures done. I know.
All right, anyway, introduction?
I'm Gina, and I'm from a little town in Washington called Quincy.
Hey!
Yeah. Yay! And I knew you were law enforcement. I knew it.
Well, my family's from Quincy.
Who are you?
The Obleneses.
Obleneses?
They actually live in Ephrata now.
Okay. My husband's at Quincy PD.
Oh.
Quincy police officer. I knew you were law enforcement. I told you he's a cop. Anyway, on June 20th, Dr. Rutledge saved my life.
Oh.
He did a 7-foot bypass, and on June 27th, he saved my son's life and did an 8-foot bypass. He's 17 years old, was 395 day of surgery, and is 285 now. We both weigh the same now. October, what's tomorrow, 24th, he'll be saving my husband's life. So prior to this, I was on 2 diabetic medicines, Actosin and glucophage. No longer taking that, haven't since the day of surgery. So my A1C before surgery was 12.
Ooh.
Yeah.
Ouch.
And I had it checked last week, and it was 5.5.
Oh, all right. Wait a minute. Let me just stop for a second. Now, this is so cool. In the olden days, back when I was a little doctor, just growing up, there was a big question about diabetes. And here's the question. Do we really need to fiddle with all this controlling the sugar? I mean, hey, you're diabetic, just relax, and don't get all wound up about what's called tight control of your sugar. Constantly fiddling, constantly measuring this, and constantly to really tightly control your sugar. Why not just let the sugar go, a couple hundred here, a couple hundred there, leave it alone, okay? They did a big study, and now we know the answer is tight control, lower amounts of abnormal sugar means less heart attack, less stroke, less death, less amputation, and so better control is longer, healthier life. And they came up with this new measure called the hemoglobin A1C. Basically, that's hemoglobin dipped in sugar. Okay, and the more sugar-coated your hemoglobin is, the longer your sugar has been out of control in the previous couple of months. So the worse that is, the higher the chance of death, blindness, kidney failure, amputation, stroke. Okay? Her pre-op was 12. High risk of heart attack, stroke, death, blindness, amputation, kidney failure, dialysis. And now it's 5, which is normal. Yeah. That. Now, when I die, you come up to the pearly gates, you know, and the gates open, and there's the guy, St. Peter goes, see.
Oh, you're in. Don't
Rutledge.
worry. You're in. No,
you cured diabetes.
And you cured my high blood pressure. I was on Altace before, and ran about 140 over high 80s on that. And I had that checked last week, and I was 106 over 62 without. But anyway, so we're here for the 3rd time in Vegas this year. We were here in June. It was hot, and I didn't need a patch. 115 degrees, and I was here for 17 days, and it was miserable. But anyway, so, and my son Josh, he ended up having to stay the extra night from the swelling. I left him that night to go to your clinic. You had just given him the cocktail. Right. And I came back, and he was sitting up eating, a whole new person in a matter of 2 hours. So that was awesome.
So this
and then
let's just talk. So for anybody who's having surgery this week, just a reminder, you should be able to swallow and everything like that. If you're having trouble swallowing, you call me, and then we'll fix that. That's usually, if it happens, it's not common to have it happen. It probably happens in 1 to 20 to 50 of our patients. And if that happens, you have some swelling, and call me. So we've had some people just toughing it out. They have a whole evening when they don't feel well, and so this is worth talking about for a second, and worth everybody hearing on the internet, because you shouldn't just be there in the hospital not feeling well. You should call me. That's the thing to do. And we had some other examples of post-op patients who talked about, call me. Okay, call me, because then I can help you. If you don't call me, I can't help you.
True. So and then he had the only other complication was the IV, and you were all excited.